been a while since we've done an interview. As I was saying just before we started the recording, like I don't want to force these things. If I encounter people that I think are really interested and they have something to offer, then we'll do them. And recently I got a chance to meet Dr. Sarah Blair here. And, once we got to talking, I think she's got a very interesting story. Their company does some very interesting work with dentists. So I'll give you a quick intro of Dr. Sarah Blair, Mark Ketterhagen, how I think, they can help you guys, dentists trying to improve your practice, trying to improve profitability, because I think we'll get a lot out of talking to them today. But primarily what I was interested in is that, many consultants that we work with, that we talk to, I mean, they're great people, but they're not dentists, right? So they're often teaching things that like, yeah, it sounds great. Yeah, you could just do this and that and everything kind of works out. And it's not always, because when you're a dentist and you're trying to balance like doing clinical work and, the massive amount of effort that goes into doing that well, continuing education courses, years of dental school, and then on top of that, you're trying to run a business and manage a team and all these things. Like it's a lot easier said than done. So I always have a lot of respect for people who, talk the talk, but they've also walked the walk, and, they've actually built and grown a practice, and they can, give you a perspective that's a little bit more realistic of like what is actually achievable and how do you, actually grow a practice. But to give you guys a quick introduction, so Dr. Sarah Blair, she's a general dentist who transformed a small office into $1 million practice in just a few years. She was recently named the 2023 Alumna of the Year for Marquette University School of Dentistry. She and the co-founder, Mark Ketterhagen, who has a master's in educational leadership, has coached dozens of leaders. They founded Indie Practices in 2018. In response to, they saw a need for practical and affordable dental practice coaching. So Indie Practices exist to help leaders grow so they can achieve professional and personal success. They're passionate about supporting young leaders and independent practice owners in, increasingly very competitive and challenging dental environment. They believe in the power of transformative leadership and regarded as the most important investment of, that a practice owner can make. It's their goal to move each and every client to an elite level of leadership, practice management, and ultimately profitability. They offer customized client coaching, leadership development for growing organizations, and team training. So again, what I really want to focus on is the fact that you ran a practice. You talk the talk, walk the walk, but you actually made it happen. And again, I think that's really important. And the other thing that really made me want to talk to you guys a bit more is, you said something about a lot of these problems that dental practices are dealing with, they really stem from the top. Whereas a lot of consultants try to start training from the bottom. Oh, your team need training. And the dentist like, yeah, there's just, my team is really lacking. And it's like, the reality is no, it's actually the dentist usually that needs the most training, not from clinical work, because they do an excellent job there. Dental school does a great job of preparing you for how to be a very good dentist. They do not prepare you for how to lead a team, how to run a business, how to motivate people. And ultimately, kind of a practice is sort of a group of people. So I thought we shared very similar beliefs in terms of how do you act, what gears do you, what switches do you flip to grow a practice? But I want to start with kind of, a question that comes up all the time. It came up in our last webinar that, you're a part of as well. We hear it all the time from clients, from prospects. They say, my problem is, I don't need that coaching, the leadership training. I don't need any stuff. Really, my problem is people just keep calling and they cancel last minute. I have all these no-shows and all these problems. It's can we just fix that? And to me, it's always interesting because it's they don't seem to understand that is a symptom of a much deeper problem, right? It's not if you just had the right verbiage and if you just say this on the phone, then you'll solve that problem and all your headaches will go away and your practice will function smoothly. It's you need to trace this back to how this, why this happens, right? And I think it's a much deeper problem of the staff are not engaged. They're not really well trained. They're not engaged because the dentist is not really engaged with them. The culture at the practice isn't a very positive one. People just feel it's just grind every day. They lose enthusiasm. The patients feel it. It just kind of that stress stems from the top and it just whittles down all the way to the patient. What do you guys think? Do you agree with that? Do you disagree? Ultimately, what do you think sort of the root cause of, we have all these patients that just don't seem to want to show up, or they're canceling last minute. The patients aren't good. do you really think it's the patients, or, is the problem somewhere else?
Yeah, I agree with your assessment that it starts way, way, way further back in the process than that phone
Yeah.
call. That cancellation phone call is kind of the final symptom of what's happening, but it's a much deeper problem. And that's where we take a really different approach than a lot of coaches and consultants. I had worked with coaches and consultants in my own practice, and they come in with this cookie cutter approach, and they shut down the office for a week,
binder,
and
right?
it's
The
this big
massive
deal.
binder.
Yeah,
Yeah.
exactly. And we take and then they come in and train the team. And especially in today's labor environment, that just doesn't work, because the leader is always going to be there, but the team will come and go. So you could pay for tens of thousands of dollars of training for your team, but that team might not even be there in 6 months or a year. So it really starts with the owner of the practice, the person who is responsible for leading the team and making the practice thrive. That's the leader. And so we step back and we take an approach that is much more behind the scenes. We don't come in and shut down your practice. We work behind the scenes, almost like a partner with the leader, coaching them to lead their team.
So just before you jump in, Mark, to tell you sort of like one of the most extreme cases I saw is one of our practices sent their office manager to like a $40,000 training program, flew them out there. Like basically they said, we want to invest in you. We want to turn you into a superstar. And, the dentist never felt like I need training. It's like, I'm already a good dentist. Like, I'm going to send you to be a good office manager. And after like a few months, she decided, I don't really want to do dentistry anymore. I just kind of like want to pursue my passion of interior design. And then she just left. And then this was, of course, after the bill was paid. And they're kind of like, well, would have been nice if you could have like told us this is where you were headed, before we invested all this time and money in you, right? So you're so right about, the people might not be there. I mean, there's a lot of turnover in dentistry. And you're right. I think the best investment is to invest in yourself first. Yeah, Mark, what are your thoughts on it? Like from a leadership perspective?
I think that the single most valuable tool a dental practice owner has in building a great practice and increasing profitability is their ability to build and manage a healthy team and culture, period. And dentists invest tens of thousands of dollars in their team going to trainings, themselves going to trainings, and worrying about their clinical skills, worrying about their front office, worrying about the decor in their office. All of it is backseat to their ability to lead a team and motivate their team and build a culture, because it affects everything else that happens. And that makes people really uncomfortable. And we see a lot of dentists who just aren't willing, one, don't believe that or aren't willing to accept it. And then two, even if they do, they aren't willing to take the steps to invest in their own leadership journey and really use it as the primary lever to move their team.
Yeah, I absolutely agree with that. It's not just in dentistry, it's any kind of business. Like RevUp, like we used to be a pretty small team for a long time until I started investing more in just learning how to lead a team, learning how to build, like ultimately, as a dentist, you're at the mercy of your team. Like that is the business, right? The patient doesn't know whether you did a good job on that crown or that implant. I mean, they don't really, that's not what they base their decision on. It's, how well they're treated, how like, and that all really stems from having a strong culture and things like that. And I think like a lot of dentists just don't really understand the value of that. It sounds really wishy-washy. But
sure.
Having grown, we've got about 50 people on our team now. I can tell you, we wouldn't have gone past 5 employees ever if I never stopped and invested in leadership training and things like that, right? So I'm a big believer of it. I think you really have to start from teaching the dentist and then working your way down, teaching the rest of the team, right? Because to jump in the second point, I mean, I think a lot of practices, they're kind of like immediate instinct is to just blame the patient, right? Like, oh, the patient's not serious. Oh, the patient just can't afford it. Oh, patient's this and that. It's like, but it was pretty eye-opening when, it's like we would have our team answer the phone for some clients. And it's like, well, why is it when they talk to our people, they seem to want to book, but when they talk to yours, they don't want to book, right? So, like it's a lot. There is obviously staff training that has to happen, but you kind of have to ask yourself, like, well, why aren't the staff better on the phone? Why aren't they more engaged, right? And a lot of people that we talk to, they kind of tell us like, look, I've been working here for like 10, 15, 20 years, and not once has this dentist bought me a cup of coffee, right? Like there's never any appreciation. Like every time I make a mistake, I get yelled at, but every time I try to go above and beyond and call patients back and try to, do more to help this place to book the schedule, there's no reward. There's no appreciation. There's no recognition, right? And in fact, I've had a lot of dentists say, it's like, well, I pay them their salary. Was that not enough? It's like, that's terrible leadership. It's like, no, because especially in today's environment, they can quit and get a job tomorrow because everyone's trying to hire. Like there's a shortage of staff, right? So you can't think like that, they should be honored to have a job with you. It is a team effort. You all have to work together, right? So what are your thoughts on that? Like, do you guys work with staff or like clients where you start to realize like the reason your staff doesn't perform well is not because they're not capable of it. It's just they're just not in the right environment, the right culture to feel appreciated, to feel empowered.
Yeah, Nick, going back to what you said earlier about a lot of people view leadership skills as wishy-washy or kind of vague, aspirations of leadership. But what we have found is that it's actually not that wishy-washy. There are some really clear tactics and strategies and skills that a leader needs to have and that they can learn. And so I think it's not as wishy-washy as people think, and it's something that everyone can grow and develop. And so I think once dentists realize that, hey, there are specific things and behaviors that I can do that will positively influence my team and my office culture, they can start to see the results and realize like, oh, wow, when I do show appreciation, even if it's something small, I get this different result. And so I think that's really eye-opening for leaders. And Mark, did you want to add to that?
Yeah, I think diners don't go to their favorite restaurants because the hosts are good at answering the phones. They go there because they love the restaurant. And why do they love the restaurant? They love it because the food needs to be good, but then the atmosphere needs to be great, and the people need to make them feel like they're cared for. And then what happens is the people who work at that restaurant like working there, and then that comes across when they answer the phones, because answering the phones is important. The same things apply to a dental practice. You could tell your front desk how to answer the phone, but if they don't love it, and if the patients come in and don't love being at the practice, and of course the dentistry needs to be good, but patients need to feel like they're well liked, and that will come across on the phone when your front desk staff is part of a strong culture and has simultaneously been given clear instructions and a good framework for how to answer the phone positively and convert a lot of those calls.
Yeah, even if you give them the right verbiage, you can always sense, like, how you can tell people aren't happy, they're not smiling. Like, you don't have to see their face. It's just obvious, just listening to them. Right. So you can give them like say this intro this exact way, thank you for calling ABC Dental. How can I help you? But there's a difference when you say, thank you for calling ABC Dental. My name is Nick. How can I help you? Versus, thank you for calling ABC Dental. My name is Nick. How can I help you? It's like, and it's like, but say it with more like love and enthusiasm. It's like, but how can you if you don't feel great about where you work?
Exactly.
Right? You can't fake that, right? So again, it's like a lot of dentists, I feel like every webinar we do, every video we have, they're always searching for these tactics. Like, what do I say? What's the verbiage? What's the sequence of things the buttons I got to push to make it all work? And they don't realize like the bigger, what they deem is very wishy-washy. It's like, that's really what you have to nurture and learn how to create in your business.
Exactly.
Without that, you're never like, even if I tell you exactly what to say, it's just still not going to work. People will feel that you're not genuine. There's something that's not congruent there, right? So I mean, you guys listen to the phone calls of your clients as well, right? So when you start working with a practice, I mean, typically, what do you notice when you listen into their calls? Because ultimately, you're trying to help this dentist understand like the problems at the bottom, they really stem from the top, right? So what are the signs of an office that the leadership isn't great, the staff isn't engaged? How do you notice that when you're like looking at the very bottom level of like how they interact with patients? What were you guys noticing?
Yeah, so I think it really starts with the greeting and with answering the phone. So first off, if the phone is not getting answered consistently, then that's a big sign that perhaps they are understaffed. And that person who's at the front office is trying to do a million things, and getting to that phone is falling to the bottom of their priority list because they're overwhelmed, and the dentist probably has no idea that they have so many things on their plate. And so I listen, first of all, to just see, is the phone being consistently answered? How many missed calls do we have? And what are the time frames where those calls are being missed? Is it right during business hours? Because that's a big red flag to me that something is off with either the physical setup of the phone system or with the team, is understaffed. And then going from that is, once the phone is actually answered, how is the greeting? So like you mentioned, is the greeting robotic and reading from a script, or is it literally no friendly greeting at all, just a hello? Or are they giving a full, friendly, complete greeting? And that's kind of the first initial sign that we all listen for on phone calls. You've listened to tens of thousands of phone calls, and that's such a great indicator right there. It's just kind of that little litmus test where you can tell right off the bat how things are going in the practice and how is this team member handling phone calls. So that's kind of one of the first signs for me.
Yeah, there is a framework that is critical. So we have a framework that we listen for when we hear calls, and it's important. And if a front desk staff uses it, they're going to convert more calls for sure. But it's not just a matter of using the framework. It can be a growth mindset issue with the leader, because I think you mentioned it, Nick. Front office staff, they're good people and they mean well, but it may not come across on the phone. Why is that? Well, maybe they have never been trained. Or even if they had been trained, the leader doesn't feel empowered to actually do anything about it. So we'll listen to these calls and we'll listen for this framework and say, oh, A, B, and C could go a little bit differently. We'll ask the leader about it, and they'll say, oh, well, that's how Michelle is. There's nothing I can really do because Michelle is just that way. And so, it's tough. And that's where it really becomes a growth mindset issue, that you as the leader have to believe that you have the ability to change the weather in your front office or change the weather in your practice so that people behave differently and can use a framework even if it's unfamiliar to them.
Yeah, that's very interesting point. So yeah, like number one, like when staff are overwhelmed, I found it always odd how they're just so unwilling to admit it. Like, it's just like, no, I can handle it. It's like, I don't want to let them down. I can handle it, right? It's like, but you're missing 30% of calls. And it's like, well, I mean, I'm only here 8 hours a day. It's like, no, you're missing the calls like at 10, 11, 12, like during business hours, right? Yeah. And they have such a hard time admitting that, sometimes it's because they live in this environment of fear where it's like, I don't want to lose my job. I don't want to, like they think maybe the dentist is going to be very upset if they find out there's problems. And some of them do, like the moment they see that, the missed call rate is high, they go and they yell at the staff. And it's like, but your staff aren't waking up every day trying to figure out, like, how do I screw over this business? Okay, people don't they don't really think like that. You might have 1 out of 100 people that is, has that sort of mindset. It's very uncommon, right? The more likelihood there is that, again, it's like a leadership issues, and they just don't feel empowered. They don't feel like they have a say or anything like that. But from Mark's point, it's also interesting because we've encountered a lot of dentists who they say exactly that. Oh, that's just how Suzanne is, I mean, and they're looking for some band-aid, some external thing, like maybe we could just improve the website and it'll kind of make up for the fact that my team isn't great, right? It's like, that's not a good solution, right? Like if your engine in your car is broken, I'm not going to maybe just add a spoiler and some more stickers or something. I don't know. We don't want to lift the hood because that's messy. There's, a lot of oil down there. I mean, I want to get my hands dirty, right? It's like, but you can't fix the car if you're not willing to get your hands dirty and deal with some of these interpersonal issues, right? And you're right, how a lot of dentists, like they see that and they just like, oh, I'm busy in the operatory, I gotta go, right? Like they don't want to deal with all that like emotion and things like that because they think very logically, right? So how do you get them to like realize that, like, no, you have to wear the business owner hat and start to deal with some of the stuff? Because we hear all the time, it's like, can you just talk to my staff for me and just kind of like you address that with them? It's like, no, because if they don't respect you, they're not going to respect us. It has to come from you. You're the owner, right? You can't delegate ownership responsibility to a company you've hired. That doesn't work, right? So how do you get them to like, can you get them to do that? Is it like, what's the success rate on them realizing they have to wear the business owner hat?
I think that facts speak well to that. So actually confronting them with data is very helpful. So I think what you guys do really well is to put together data that cannot be argued with. So there's no way to deny that this is reality when you can clearly see how many calls are going unanswered and how ineffectively the calls are being handled. I think listening to some recordings really helps dentists to see as well. They are shocked, just absolutely blown away sometimes when they hear what their team is telling patients on the phone. I had one client whose team was telling patients over the phone that he didn't do extractions. So if they had an issue where they needed to have a tooth taken out, his team was literally telling patients, oh, no, well, we'll probably have to send you to an oral surgeon. And this is a dentist who had done tons and tons of CE and had done missions trips and all this stuff too. He was an expert in extractions. And I told him several times, hey, this is what they're saying. Until he heard the calls himself, it was really hard for him to believe that. So I think
I've got an even better one for
reality.
you. I've got a dentist who this was years ago, they had hired us to help them drive more Invisalign patients. And, at that point, we were only really just focusing on marketing. We were doing a lot of campaigns. We were getting all these leads, and they kept saying, like, we're not seeing any results. Like, we're not really getting any Invisalign work. Like, what the heck are you guys doing for us, right? And it wasn't until we started digging through the calls to figure out, like, something doesn't make sense. People are going to this page. They're requesting appointments. Like, what's going on here? And then we heard their receptionist, who, to her credit, had only worked there for like maybe 4 months. She was telling every patient, yeah, I don't think we do that here. And of course, the person was very confused because, like, but we're spending thousands of dollars on ads to promote Invisalign. This doctor's done hundreds of cases. What are you talking about? And the patient would ask, like, oh, like thinking maybe they called the wrong place. Like, oh, is there someone around this area that does it? And she would send them to their competitor across the street. Oh, you could try Dr. So-and-so. And like, she wouldn't believe it until we showed her and said, like, yeah. And it's happened a lot. Yeah. Like but I mean, you look at from the receptionist point of view, I wasn't told, most of them, they get hired, here's the desk, here's the phone, here's, you sit in this chair, good luck, figure it out, right? But imagine when you're being trained as a dentist, here's the operatory, here's a bunch of tools, there's a patient there, figure it out. No, you're trained step by step on how to do it, right? So no one's ever trained on what do we even offer. It's funny how you ask, one receptionist might have a very different answer from another one. They never stop and think about it because the dentist thinks like, well, you work in dentistry for 10 years. Don't you already know all this stuff? It's like, no, something you still need to discuss as a team.
Absolutely.
Do you guys encounter that a lot? Like one thing we've noticed when we listen to a lot of calls is depending on who you talk to, you'll get very different answers for very common questions. It's almost like nobody sits together and has a huddle to say, what do we offer? How do we promote it? How does it actually work? And it leads to a lot of frustration with patients because it's like, well, when I called, you said you did. No, we don't do that.
Yeah.
Like, pretty sure I called you guys. It's like, no, I think you're crazy, right? So.
Yeah, I think that comes down to, well, first off, just training on phone skills, but I think it also comes down to team calibration. And so one thing I really recommend in team meetings for dental teams, led by the leader, the dentist, is to go through cases together and talk about, hey, what do you see on these radiographs? What do you see in these photographs? What do you think might be some, solutions, some treatments that would be appropriate for this case? And then let's look at how that turned out in real life. Let's look at some after photos so that the team can see, what do we really actually do here in our practice? And what are the results that we're actually getting? And let's make sure we're all on the same page, because I think the team at the front office is often very disconnected from what's happening in the back and happening clinically. Sometimes they really it hasn't been shared with them what's available and what the doctor does do on a daily basis. So they just see the codes and they see, the terminology. They don't see the actual procedures and the outcomes. So I think that's why team meetings are so important. And that's why, unfortunately, something that dentist leaders often shy away from, having weekly team meetings, or they're led very ineffectively. But I've seen that doing a clinical calibration together, almost every meeting is super helpful to get everyone on the same page. So we're all talking the same language. We're all explaining things the same way. And we all know what we do here at our practice, which is sometimes we think, oh, it's so obvious, but for the front office team, it's not.
Totally agree, Sarah. When you see a wide variance of how staff are performing, how they're answering the phone, how they're engaging, they're doing it very differently, that often is an indication that the leader is relying on individual personality and experience more so than their own leadership. They're just kind of hoping, well, if I can get all the right people who are really, really good, then I don't have to do anything. I can just sit back and let them do their thing. When actually they need to be providing the training and leadership and making sure there's clarity on how people ought to be behaving in the organization. And that's typically what it's a sign of when you see just a wide range of how people are behaving.
Yeah, it is interesting because there's a lot of dentists that we talk to, and you start to piece together, like, do you guys ever meet and talk about these like basic things? Like, these are the problems that baffle me why they would even happen. Like, why would one person say, yeah, we do Invisalign, the other one says, no, we don't. Another thing you brought up is I've almost never heard someone say, like, you could have a dentist who's been doing implants for 30 years and nobody will ever mention, it's like, yeah, we've got a great dentist. He's incredibly good at this, right? I mean, to the opposite, we've had dentists who, they taught at universities, they taught implant courses. And, a patient would call and ask, well, is your doctor like a specialist? No, he's just a regular dentist. Like, okay, I understand he doesn't hold a specific specialty, but what the patient's actually asking, to me, it seems obvious. It's like, are they good? Would you go here? Like, well, am I in good hands? Does this person know what they're doing? And she kept explaining, like, no, he's just like a regular dentist. Like, he's not specializing in implants. It's like, first of all, yes, he is, because that's all, like, mostly what this practice does. He's been doing it for like 30 years. He teaches courses at the university in implantology. Like, but yeah, you're so right about, disconnect. That's like the one problem with practices is what happens at the front desk. Nobody understands what happens in the back. These things don't really interconnect. And then you get so much confusion that, when the patient says, yeah, let me think about it, really what they're saying is, I'm getting a lot of doubts about coming here. It's not that at the end of that call, they don't want to fix their teeth, or their teeth are like magically got fixed from talking to you. They want to fix their teeth. They're just not sure if they want to come here anymore, right? And a lot of disconnect is a huge problem. So how do you guys, like, a lot of dentists, they don't do these daily huddles. They don't do team meetings. So do you guys teach them, here's how you actually get everyone together, and you lead a meeting and you make sure they're all aligned and we're all saying the same thing and we all have the same beliefs and we agree with what we're saying and, we're all on the same page together?
Yeah, team meetings are something that we talk about a lot. And we actually just created 2 training videos that are on our website. So one is about leading effective team meetings. So a whole team meeting that happens, usually I recommend once a week. And so we created a great video about that, the key points and elements of those type of meetings. And then we also have a document and a great video about huddles. So huddles are more of the daily check-in that would happen before the day starts. And huddles are just such a great way to get everyone on the same page, make sure that we're all looking at the day the same way, and that we're all seeing any bottlenecks or any challenges that are going to arise, and then brainstorming together how to deal with those things. So it just blows my mind when, I don't know, it falls by the wayside so easily. We say, oh, well, Jan can't be there till 8, so we just can't do the huddle because she won't be there. Or, I've got to drop the kids off, and so, we can't have the huddle every day. You have to find a way to make these meetings and communication between your team happen. And sometimes we have to be creative. I'm not saying it can happen exactly the same way in every practice every time, but you have to find a way to make that communication happen with your team. And if you don't, you're going to see these results where communication's inconsistent, the team is not aligned, and you don't have that common language and culture together.
Meetings and huddles are, the purpose of them is for the leader to develop and grow how their team performs. And I think sometimes leaders think the purpose of them is for me to give my team information. And that's true a little bit, but the bigger purpose is to grow and develop how your team is behaving and performing. That's why you have meetings. That's why you have huddles. And it's just such a missed opportunity if that's not happening.
Yeah, because there's a lot of day-to-day things that kind of slip through the cracks. And when you have these daily huddles, you kind of show that like, no, we are paying attention. We do care about all these things, like who's coming in today. Let's make sure we do the A, B, and C. Who do we have coming in tomorrow? How do we organize this problem? And then they feel like they can come together and, bring problems, talk about operational issues and things like that. I mean, for me, I've always like, it seems like one of these things like, just breathing, like this is like what you have to do in a company. You have to meet, you have to talk about like common bottlenecks and things like that. And I've always been shocked with dentists that they would look at me, it's like, no, we don't do anything like that. I mean, in a lot of offices, the dentist comes in, or they come in after the staff, or maybe they leave early and the staff don't even know if they're there. I think you snuck out the back, and it's like this office can't function like to be this disconnected. You do have to bring everyone at least once a day, even if it's 5-10 minutes, and just like discuss like what's going to happen in the day. But they see these meetings as sort of a chore. And I sort of like going back to the question I had earlier, it's like sometimes you will run into a dentist that they're very introverted. I mean, I was one of these people. Like I want to sit there and design the program and write the code. I didn't have the sort of leadership skills, right? Eventually I sort of saw that like you have to develop them. Like it might come really hard, but you won't have a business without that. How do you deal with like dentists who are just not prepared to step into that role? It's like what they're really looking for. And I think what a lot of consultants offer, because it sells, same thing as like the weight loss industry. Everyone's trying to sell a magic pill. If you just eat this magic goji berry juice, you'll just lose weight. It's like, no, you won't, right? But I feel like a lot of consultants sell this idea that if I come in with this binder and I implement these systems and I train your staff, then you could just go and be a dentist and everything will work without you being involved. And it's like, what universe do you live in? Like this, that is never going to work, because if it did, that consultant would also be smart enough to realize, why am I giving you that? Why don't I just buy the office? I'll get the associate. I'll find a way to like own the office, even if I'm not a dentist. I'll implement this magic system that just doubles it, and then I'll sell the business for money, like for a lot more money. Why would I sell it to you, right? So I think if it sounds too good to be true, it usually is. But I guess again, my question is like, how do you guys tackle the dentist that's a little introverted, doesn't like to deal with staff issues, it's very new to them? Like, how do they start dipping their toes in the water and get comfortable with like, okay, we're not going to do it all in the beginning, but let's start slowly getting comfortable with the idea of like, wearing the business owner hat?
Yeah. So I think people often have the mistaken idea that being a leader is about charisma, or about being able to, take over the room when you walk in and everyone's going to just follow you. Because you're the leader. But I think leadership comes in a lot of different shapes and forms. And I think we sell ourselves short by thinking that you have to be this very outgoing, very charismatic person. But I think, going back to what we said earlier, it really breaks down to a series of small behaviors. So you can build those building blocks, the small series of behaviors that you can learn, that anyone can learn and grow, and you can be a very effective leader. I think some of the most effective leaders are quiet people, so introverts, because they can lead with consistency and character, and they can learn those behavioral skills that allow them to lead their teams really effectively.
Totally agree with that. It's less about charisma. It's about willingness to take the steps. And if you're a dentist who just wants to do dentistry, I just want to practice dentistry, then maybe being an associate is the right position for you. If you're going to actually own and lead a practice, lead a team of people who are depending on you for direction, you must have a willingness to take leadership steps and improve your leadership behaviors. So much more important than personality or charisma.
I 100% agree with that. I ran into the same thing when I was starting a business. Is I always felt like I don't have that personality type where I'm going to walk up on stage and rally the troops and things like that. And I always kind of felt like maybe I don't have what it takes. But I realized over time it's like, no, it's not about that. I'm sure in the movies, whatever, but it's not real leadership. Real leadership is, like you said, it's about implementing small little changes, consistency, like little behaviors that you lead your team. It's not so much about like putting on a performance as it is just being that sort of anchor for people that, they know they can come to, they know you can guide them in the right direction, and they don't feel like they're being judged. You're always coming together as a group to try to solve problems, and they feel empowered. But now I am interesting because you touched on an interesting point there with, there's small habits you have to learn. What are some sort of like habits, like little things that dentists do that they're not even aware of that kind of like destroys the trust, the morale with people? And they might not realize that how destructive those little behaviors are. Like, what have you seen with the offices that you guys have worked with?
Yeah, Mark, I'll let you take this one.
Trust is the basis of organizational health. This goes to Patrick Lencioni, if there are any Lencioni fans out there, but absence of trust comes from people not being vulnerable, dentists not being willing to be vulnerable with their team, not being willing to allow for healthy conflict in their organization, and people start to not trust each other, not be honest with each other, and the interactions between people become not real. The feedback becomes fake. People start to behave in a way to preserve false harmony when there are real problems and pretend like they're not there. And so I think the willingness of the leader to be authentic with their team, to be vulnerable with their team and honest about things they're seeing, things that are going on, and where they want to improve as a team is the very, very basis, the entry point for building healthy team culture.
Yeah, I would add on that, we start with those basic skills and teach leaders those skills. So one great example is accountability conversations. So when a team member isn't performing, how do you have that tough conversation? This is one of the biggest challenges for leaders, and it's a hard skill to learn. But once you have this in your toolbox, it gets so much easier, and you can actually deal with these problems and not be afraid. And so we love to coach on things like having effective accountability conversations, effective one-on-one meetings with your team, check-ins, and great team meetings, things like that are just learnable skills that we can add to our range of tools to be an effective leader.
Yeah, no, I that definitely resonates with me because I think that I've worked in a lot of businesses before I started my own company. And I think when I look at what made me leave each of those, it was definitely a lack of trust. It was like, yeah, something was promised, and then, they found a way to mental gymnastics their way into, well, actually, no, it was kind of different. And it's like, well, okay. But there's always like little things where it just doesn't seem like you have a lot of faith in what anyone says. It's almost like you take away the foundation, right? Whereas there have been business that I have worked on where it's like, no, if this is what was said, this is how we're going to do it. We're going to stick to that. We don't find excuses to say, well, that rule applies to you, but when it comes to the boss, I mean, it kind of works differently for him. And no, like everyone follows the same thing. And even in our own business at RevUp, like, I feel like we've made that a big priority of, nobody's on a different level. Like we're all on the same playing field, like the same rules apply to all of us. If I accidentally put a pack of gum on the wrong card, not my personal card, but the company card, I will reimburse that like $2 because like, you just can't, like, it really bothers me that it's like, no, this, you need to do things correctly. So I agree. Trust is so important. There's a lot of things that, I've seen dentists do that kind of like, destroy that trust, and it's hard to gain it back, right? But I'm curious. So, of course, eventually you train the leader. I mean, you go down to the management. You eventually you're training staff. Like it does have to sort of cascade through the whole organization. Yeah. But you will run into situations where there are some staff that are just really difficult to train. Like they just like don't want to learn, or not that they don't want to learn. They don't feel like there's anything for them to learn. So I've always sort of found it interesting because people sort of go down two different paths, right? Some believe that it's like, look, with the right leadership, with the right, like having a heart to heart and being vulnerable with them, like you can eventually, get people to change. You just about being patient, having the right conversations. It is possible. There's also, dentists and coaches and, business owners that go down the path of it's so much easier to just like find the people who are more closely match what you're looking for instead of trying to turn someone into something they're not. Maybe there's, a bit of a middle ground. if you're working with a team where the dentist buys in, the managers buy in, but you have one receptionist who just refuses to, like see the light of day, how do you deal with that? Do you advocate for, it's like, look, are we going to spend 10 years like trying to like make this person different? Should we just hire somebody else? Or or is there some way that you found that like, no, we can get through to people. It's rare that they won't get the message.
Mm-hmm. So sometimes I think it's a matter of having the right people in the right seats. So maybe that person that you've put on the phone is super knowledgeable, sometimes almost too knowledgeable clinically, and they want to share everything with that caller that might be wrong with their teeth. But maybe that person isn't best on the phone. Maybe they would be a great insurance coordinator, or maybe they'd be better clinically in the operatory. So I think sometimes it's a matter of, we can make some changes in our org chart that might allow that person to continue to contribute to our team. But sometimes I think this goes back to another leadership skill that we teach, is creating a mission and a series of values for your team that you can use to guide decisions like this. So if I have a set of team values and it's very clear to me that this team member is not aligned with those values and that they directly actually contradict some of those values, that's an easier decision. They just don't belong on my team. So it's not so much that they're in the wrong role, they just literally are not in the right organization.
Yeah, I think both those things are true. Yes, certainly it's true that if you hire great people, then it's easier because then they're going to be more effective and it's easier to lead them. Yes, that's true. But I would stop short of saying then you don't have to do anything as a leader. Because certainly if you can hire great people, that helps. But I would note that there are a set of leadership skills involved in the hiring process that help you hire better people. So the people you hire is a bit of the reflection of your own leadership skills. But then also, even great people need to be supported and coached and pushed and developed. If you just leave them and let them do their own thing, their behaviors will become divergent. So both those things are true. And there are going to be situations where someone is not a good fit for an organization. That will just happen, even though you're pushing and developing people. So a leader needs to know how to do both those things, hire really great people, as well as lead and coach and develop their practice and make decisions when someone's not a good fit.
Yeah, I think it's interesting with the hiring, because there's a lot of dentists that we work with where it shocks me when I learn that they're not actually part of the hiring process. The office manager does it. And it's like,
that's incredible.
Okay,
but then, amazing.
And these are always the offices where they have sort of the weakest staff. And you start to realize, like, but doctor, like, okay, let me put it this way. What incentive does your office manager have to hire someone who's an, superstar? Like, you don't realize that these people are actually very threatened by anyone who's really good, because, in dentistry, there isn't really a lot you can climb up. You're a receptionist. Maybe you move to a treatment coordinator if it's a bigger practice, and then you move to office manager, and then you're at the top. And when you're at the top, your goal then, there's nowhere else to rise. Your goal then becomes to stop other people from climbing to the top, right? So usually the dentists that are very involved in interviewing, hiring, like they really want to get to know the staff that they're bringing into their practice, they tend to hire much better people. When they delegate that responsibility to a manager, the manager's incentives are not aligned with the business owner who owns the business. Their incentive is to hire the people that will make them look good, right? So when that new receptionist says, I don't think we do Invisalign, right? Then the office manager could say, well, see, this is why you need me. Everything would fall apart without me. And I've told a lot of dentists, like, how can you not be involved in hiring? Like in let's say the startup world, the tech world, one of the first pieces of advice any business owner gets when they get, venture capital is like, you have to be remaining in control of hiring people for as long as you possibly can. And when you look at companies like, OpenAI was, pushed for like ChatGPT and things like that. One of their CEO to this day still approves every hire. And you're talking an organization of thousands of people. So you as a dentist with like 6 employees, what do you mean you don't have time to do the hiring? That's ludicrous, right? These are all these problems stem from. Did you guys encounter that, like dentists who just they don't feel that they need to be in the interview meetings? Like, I've been baffled by this, but my guess is something like 40-50% of them just delegate hiring a receptionist to their office manager, and they're just not even involved.
Yeah, I do see that a lot, unfortunately. But what I see even more often, I think, is just hiring in a state of desperation. So they have not given any thought to this previously and suddenly need to hire somebody. And so they're absolutely panicking and they make a very hasty decision. And so I think, especially in today's current scenario, we have to realize we're going to have to hire. We will either lose someone or our team just needs to grow. So we need to be thinking ahead. We're going to have to hire whether we want to or not. So let's start thinking about who is that person that I'm looking for, and kind of developing a bench, a list of people that you have or some ideas that you have that you can go to this resource when you are in that moment that you need to hire right now. And I love the saying, hire slowly, fire quickly. I think a lot of dentists and business owners in general hire very desperately and quickly, and then are so reluctant to let those team members go who just aren't a good fit for the organization, and they let them linger in a toxic fashion for far, far, far too long. So, Mark, any thoughts on that?
I agree with everything that's been said. I would just add or emphasize that, yes, Nick, it's ludicrous if a practice owner does not want to be involved in the hiring of their team. That is crazy, and probably just a sign that they don't want to roll up their sleeves and get in the business of managing people and managing their team.
Yeah, I think, again, it's like there's certain responsibilities that you have to be aware of, that, if you want to run a business, this will never be delegated to anyone else. And you don't want it to, right? Because this is where all the problems will start. Ultimately, the company is a group of people. If the people you're putting in charge of hiring people, they're not business owners, their incentives aren't aligned with, hiring the best. The best might be a threat to their position, right? Again, it's like you kind of piece it together. It's like, this isn't going to end well. But I guess with dentists, they're busy in the operatory. They're focusing on trying to take care of their patients. There's so much going on in their head that, a lot of these things, they think that, I need to focus on what's really important. I got to take care of the patients. I'll let this other stuff slide to somebody else. But they don't realize how that eventually will compromise your ability to do great clinical, because you will have an office that doesn't treat patients well. You're under a lot of stress. Nothing's working. You're always trying to put out fires. And then in the end, by not taking care of those, business elements, the wishy-washy stuff, the stuff they think is a waste of their time, ultimately the stuff you want to do that is important is not going to get done well either, because, you're just in a really toxic environment that unfortunately you created, right? So now I'm curious, so one way I've seen, dentists try to, I have to admit it does work temporarily, is, some go down the path of, let me try to train them and send them to courses. Some of them go down the path of incentives, right? So they say, hey, if we achieve this, I'll give you some more money. And if I do this, and I've seen this sometimes work very well. Like, we've had experience with this where, some practices we were working with, it was so hard to get them to just ask patients to leave a Google review. And we would explain, look, if I'm looking for a dentist, I don't know whether you're good or this person's good. If I see you have 300 reviews and the other one has 50, I'm going to call you, right? Because there's social proof, right? If you have 50 and the other one has 350, you might be a much better dentist, but I don't know. I'm going to go to the other one, right? And the staff would say, oh, well, we're asking everyone, we're trying. It's just no one wants to leave a review. And I had a dentist walk in with a stack of gift cards, like $10 Starbucks gift cards. And they said to the staff, look, if you're asking and they're not doing it, I get it. But look, if they do leave you a review, I'll give you a $10 gift card. As a bonus. And that week they got 75 reviews. And then the 6 months before that, they had maybe 9. So it's wow, as magically as possible, right? On the flip side, I've also seen incentives that breed a toxic culture too, because then all of a sudden everyone's fighting to try to, book that new patient, and they don't pay attention to the existing patient who, it's well, there's no bonus for make sure they're happy, right? So what are your thoughts on building incentive programs into the practice? Are you for them? Are you against them? What are your thoughts? Do you guys deal with anything like that?
Yeah. I'm not a huge fan of incentives in general because what I've seen is it ends up being kind of a band-aid to try to hide the deficits of leadership in the practice and of having a negative team culture. We're trying to cover that up by essentially bribing our team to do the behaviors that we would like them to do naturally or with training.
Yeah.
And so I find that it leads to a sense of entitlement and expectation a lot where, oh, well, we were getting this bonus, but now we're not getting it, or we didn't get it this month. What happened? I blame her. So it just leads to a lot of negativity. And I have seen temporary good results. Like you mentioned, I think you can have a fun contest for your team. I think you can spontaneously reward people for doing something above and beyond. But if we're expecting our team to do things because we're giving them little carrots and, financial incentives to do the behaviors that are part of their role and part of being a part of our amazing team, that can only go so far. I mean, are you going to give bonuses for somebody saying, we're going to give a bonus for every single thing that we expect our team to do on a daily basis? That's impractical.
Yeah. Mark, what do you think?
I agree. I think incentives are shortcuts to the desired results that good leadership actually brings you to. A good leader should show appreciation for their team. They should motivate their team. They should spontaneously have events and provide moments and items that show appreciation. But if you can't get your team to do the things that is in their job description, using incentives rather than building culture that helps people be motivated to do their job is just a mistake. It undercuts your ability to continue a healthy culture, as Sarah was saying.
Yeah, I agree with that. It's like if you're looking at this in a 3 to 6 month time frame of like, what can I do that's very low effort that can like just rise things up really quickly, right? It almost reminds me of like kind of like corporate raiders and the Wall Street days where it's like, yes, I can very quickly come in and just rise profits, but at the long-term detriment of the company, right? So you're right. It's like once you build a sort of team where it's like, I'm not willing to lift a finger unless like, well, what's the bonus for this action versus this action? It's like, but then where does this really take us, right? Like, is that really healthy, right? And I have seen cases where staff are arguing with each other because, well, you're costing me my bonus because you didn't do this right, and then it just turned into a bit of a mess. No, I agree. I think if dentists could sort of like realize that the training needs to start with you. If you improve your leadership skills, that does sort of trickle down into having a more motivated team, a better culture, and that's when things kick in place. A lot of the dentists who say that we just can't find good people. It's like, problem isn't that you don't have good people. It's like there are businesses where you can take someone average, put them into it, and very quickly they'll become exceptional. You look at a franchise like McDonald's, it doesn't depend on people being master chefs. Like they can take just about anybody, put them through a very good system and, turn them into like a very functional, profitable, effective employee, or get rid of them very quickly if they're not a good fit. But their business would not work if they're always trying to find these unicorn employees. So I want someone who's loyal, who's really knows everything about dentistry, is going to, put all this, responsibilities on their shoulder, be trustworthy, X, Y, Z. Your business can't function if you expect to find all these unicorns all the time, right? And a lot of practices, I feel they have good employees, but they've built a system that just kind of saps them of their will, their motivation, their enthusiasm. And then they say, well, we need new people, right? So I think you're right. Like the short-term answer is let them go and hire new people. But you're not fixing the root cause, right? That led them to be an underperforming employee. And it's the same sort of philosophy with the incentives. Like, yes, it will get you the result you want today, but you're ultimately not really fixing the main core issue, which is a hard issue to fix. It's going to take a time, but it's a very important investment if you want to be a successful business owner. And it really ties back to the first thing we talked about in this interview is like, why are they, I'm getting all these last minute cancellations. How do I stop that? It's like, well, sure, I can give you some verbiage that maybe you could use, and but really, like you can use Recall Max to send patient reminders, and you could do all this stuff. But really, if you want to solve this problem, look at it where it actually ultimately originates from, right?
Mhm.
Poor
Mhm.
leadership, poor company culture, staff just don't feel all that enthusiastic. That transfers to how they talk to patients, sort of like how they, the value they communicate to these patients. And in turn, it seems like, well, we just never find good patients. Maybe there's something wrong with the marketing. It's like, no, right? It all just comes full circle. Now I'm curious, how do people, sort of like contact you guys? How would they get started? Like, tell me a little bit about your sort of program. Like if somebody is, interested in, how does it work? Is it, do you guys have to fly off to Las Vegas for this $50,000 course, or like what like what's your model? How do you help clients, and how do you get started? How do they communicate with you and sort of take the next step?
Yeah. So we really created a model based on my experiences having coaches and consultants and what we've seen work in the industry and what we know works really well from a leadership training perspective. And we've realized that all that fluff is kind of superfluous, and it actually gets in the way. It's an obstacle for people to move forward with coaching. And so we figured out that the essence of it is really those conversations that we have with our clients behind the scenes. And so we meet only virtually. So we're never going to come in and shut down your practice for a week and make you fly us all over the country and put us in a fancy hotel. It's all virtual. So it's not only convenient, but it's much more practical for the practice owner. So we meet twice a month with unlimited communication in between those meetings. And we come out of that meeting with action items for both the clients and for us as the coaches, ways we're going to support them, whether it's a resource or a follow-up. And then we do a little bit of accountability ourselves. So one thing that I think really helps our clients is knowing, hey, we're going to be meeting again in 2 weeks. There are these things that I know I need to get done. There's that sense of accountability that I know she's going to ask me, he's going to ask me, how did that conversation go with Diane at the front desk? And, those type of things. So Mark, do you want to add to that?
Yes, one really exciting way to get started is we have a model for what we believe elite practices are, and we measure all of our clients in 6 areas of performance. And it's our goal to get all of our clients to an elite level of performance in each of those 6 areas within 2 years. And we have an audit and tools to measure that. And an exciting thing for people who might be interested, you could go to our website and there's a short assessment that will take you less than 10 minutes where you answer 22 questions and will generate a scorecard that demonstrates where your practice is in each of those 6 areas and provides a roadmap for how we can help them. So that's an easy way to dip your toe in and see, how am I doing? Where am I at in leadership? Where am I at in some of my financial and efficiency systems? And then we can talk about ways that we can support that person.
Mm-hmm.
Awesome. So we'll
And
put the website at the bottom and I encourage everyone to just go through this, because we do a similar thing. It's like we, sort of evaluate, how does your practice measure up to other practices? Because there's usually areas that they're doing really well in and other areas that they're a little bit weak in. And I think with a lot of traditional consulting, in order to justify the big price tag, they cover so many topics that most of which is like, that's not really what your problem is. You're doing okay in these areas. Like really just focus a little bit of your time on improving these little skills. And that's what's really going to sort of snowball. Because I agree with you, like coming down, spending a lot of money, closing down the office, doing this massive training that covers a million topics. There's no way your staff's going to absorb 90% of this within a week. I mean, it's all forgotten anyways. And for what? It just seems like a lot of razzle dazzle. Like I think the model you guys have is one that I agree with. We, even with the consultants that we work with, that's how we do it. It's virtual. It's every 2 weeks. We meet, we talk, we, discuss the problems. You set little tasks that you want to get done. You have someone to hold you accountable, that you make sure that you did it. And it's that slow burn. It's like when you go slower, it's a lot smoother. You ultimately go a lot faster. It's that's what sort of like ramps things up. The coming in with a big bang and spend a bunch of money and go fly out to Vegas and do these big events, and it's fun. It's absolutely fun. But you look at those practices, because we measure their performance as well through our software. Nothing happens after 6 months. They go back to explaining exactly what they were doing before, right? And if you're going to do one of these big things, like just take your team on a cruise then. Like, I mean, it would be cheaper. They'd find it more interesting and they would come back happier. Right?
Yes, so true. I did want to just add, there's one other way that I would recommend getting started with indie practices is, although most of our work is directly with the leader, so the behind the scenes kind of executive coaching model, we do offer training in kind of bite-sized chunks. And so if you are considering doing coaching with us, but you want to have a little taste of it, we do smaller modules of training for those absolute must-need skills. So for example, phone skills. So we do a 90-minute training directly with the team that's virtual, but it's live and interactive. And it actually includes practicing answering calls and practicing those verbal skills within the training. So it's a good way to get to know us and for your team to, first off, gain some valuable skills in just 90 minutes, but also to, find out a little bit more about what indie practices is all about.
No, I love that. It's great to sort of dip your toes in the water and see if it's for you. And I definitely advocate the start small, tackle like a few things, like really work on those small little things that you're doing day to day. Like I feel like with a lot of dentists, they look at it like, well, that's it. Like, what about everything else? It's like, you don't get it. There's not like, in order to double the size of a business, you don't have to like do anything radically different. So a lot of the little things you're doing day to day, if you could just improve those and work on those little like interpersonal skills, those leadership skills, like that's what will start to really compound, right? Whereas if you go down the line of like, I need to make big changes and big direction changes, and we need to like refocus our efforts here, it's like, you're going to burn a lot of energy, a lot of money, confuse your team. They're going to get constant whiplash of just like, oh, I guess this week we're doing this. And, I've seen a lot of practices where the dentist says, or the staff says, he's just into this whatever consulting thing this month. In 2 months, he'll forget about it. Just smile and nod and, don't worry. Like, we've seen this 20 times before. And it's going to go back to normal. So I agree. I think it's like, take it in smaller chunks because, you still have to run a practice. You still have to do dentistry. You don't have the capacity to just stop everything and do this. It's better to take it slower. So I want to thank you guys for taking the time to do this. I learned quite a few interesting things here. And I think I really encourage everyone watching this to take the scorecard assessment, have a conversation. Like I said, I don't really force these interviews, and we haven't had one in for a while because you guys were, the first pair that I met that was like, actually, this would be, you guys, what you're preaching is something I very much agree with. And, working with hundreds of offices, we definitely see the difference in the ones that are doing, multi-million-dollar levels of production every year, and the ones that are, stuck at a couple 100,000 and they're always struggling. And it's not the marketing, it's not how fancy the office looks, it's not the location, it's not all these external things. It always comes down to one thing: leadership. The dentists at the practices that are like very, very successful, people love working for them. We love working for them. They're our favorite client. They're always positive. Like you always feel like you can be safe with them, vulnerable. You can, talk about problems. You're never, they're never going to chew your head off. You think about things logically, you make good decisions, you hold each other accountable to everything. And people love working in that environment. I think if there's one thing that I tell dentists to do, stop spending money on marketing, stop spending money on SEO. Like these are not the things that are going to help you grow. Okay. Once you have the leadership down, yes, this is like rocket fuel and it will accelerate you forward. Without that, it turns into a bomb because it's just going to be, you get a million phone calls and 30% of them don't get answered, or 40%. And the ones that get answered, the patients are treated terribly. And then, why do we have all these no-shows? It's like, So start with you guys, basically.
Well, thanks, Nick. We've really enjoyed being on, and I appreciate the opportunity. It's been fun talking with you.
Fantastic.
Yeah,
Thanks,
that's
guys.
great. Thanks, Nick. It was a lot of fun.